Welcome to Turning Point Breast Cancer Rehabilitation's fourth in the series of webinars on racial disparity in breast cancer survivorship. We're thrilled that you're with us here tonight for what I think is one of our most important events, that is the Voices of Patients. I'm Jill Binkley, Turning Point's Program Director and Founder, and I'm thrilled to have everyone here tonight. And let me tell you a little bit about Turning Point. Next slide. Turning Point's mission is to improve quality of life for individuals impacted by breast cancer by providing and advocating specialized evidence-based rehabilitation while eliminating socioeconomic, racial, cultural, and geographic barriers to care. Turning Point is a nonprofit organization and the freestanding clinic in Atlanta, Georgia. Next slide. I am absolutely thrilled to introduce our moderator for tonight, Consuelo Ross. Consuelo was a panelist in our second forum on community-based solutions to racial disparity. And Consuelo is now our moderator, and we're thrilled to have her back. Consuelo is president and founder of Surviving the Odds in Kansas City, Missouri. And I definitely want to leave some time for Consuelo to tell you a little bit about yourself, Consuelo. Welcome. Consuelo, can you come on? I hope you're still there. Welcome, Consuelo.
Technical difficulties early on.
Technical difficulties getting going. But we're glad we're all here and we're good to go. So welcome.
Perfect. Thank you so much, Jill. I first of all, I want to say thank you so much for including me in this most critical conversation. It has been my honor to be a part of these discussions. As you mentioned, my name is Consuelo Ross. I'm based out of Kansas City, Missouri, and I am the founder and president of Surviving the Odds. And we are a nonprofit organization that focuses on breast cancer awareness and, more importantly, early detection in women of color. Our organization provides free services to women who are uninsured or underinsured. And we have been in the business of serving our community for 13 years now. I myself am a breast cancer survivor, 14 years, 15 years now. I've lost track because I thank God every day. Our mission is to make sure that no woman is left behind and that every woman is accounted for on a continual basis. Each and every year we are in the community providing these free services, and we partner with community organizations, faith-based organizations, and our service providers to ensure that we are providing a service, whether it is resources, education, and awareness. So I just want to say thank you again to Turning Point for including me in these conversations and all of the other individuals who have lended their expertise and their voices to this most critical topic. Next slide. The need for breast cancer rehabilitation and exercise. There is strong evidence supporting the safety and efficacy of cancer rehabilitation and exercise and the prevention and management of many breast cancer-related impairments, including shoulder dysfunction, lymphedema, fatigue, osteoporosis, as well as function. Exercise has been shown to reduce breast cancer recurrence. There is a significant gap between the medical and surgical treatment of breast cancer and support for the myriad of subsequent physical and psychosocial issues. Evidence supports the critical role of rehabilitation, exercise, emotional and nutritional support in maximizing quality of life during and after treatment. Next slide. There have been several key takeaways throughout these entire forums. The first form, was disparity in cancer survivorship. And some of the key takeaways there were Black breast cancer survivors have more significant survivorship issues and a larger burden of illness. And because of that, it is really critical that our rehab providers be more proactive and seek these people out. Less than 50% of minority cancer survivors are receiving care. That is in accordance with the National Comprehensive Cancer Network guidelines. Less than 20% of breast cancer patients are referred or not referred to rehabilitation during or after their treatment. Next slide. In the second form, the key takeaways were centered around the community and building community connections. What are we doing with and not for the community? It is very important, and let me just put a pin in that right there, because when we think about community relationships, it is so important that we enter a community with the mindset that we are going to be sustaining any service that we bring into that community, building that relationship, building that trust, not coming in to do something and drop the ball and leave, but to partner and ask ourselves, what are we doing with the community to address this issue? Core tenet is building partnerships, develop a safe space and become a trusted messenger. Building a therapeutic alliance is critical. Lift up and empower the community. Navigation is an important concept to connect the community, meet people where they are. Again, navigation does not just come from a clinical process. It doesn't come from a hospital systematic process. It doesn't come from a social process. It is in conjunction with those as well as lay navigators, those individuals who are connected to the community. Next time. In the third form, which focused on national strategies, some of the key takeaways were the need to reduce power differential between patients and healthcare providers through culturally appropriate care, diverse healthcare providers at the table, relatable of clinicians, must address financial toxicity of a cancer diagnosis and the cost of cancer care. The models of care that can reduce disparity include prospective surveillance model, telerehabilitation to increase access, focused survivorship navigation, precision survivorship care, and changes in research funding and priorities to include community collaborations and the voices of patients. Turning point initiatives to reduce racial disparity in breast cancer survivorship include the Atlanta Initiative to increase access to breast cancer rehabilitation, exercise, and education. That is part of the telerehabilitation and planned satellite clinic in the downtown Atlanta office, and a hallmark of projects and community collaboration led by the Atlanta Initiative Community Advisory Committee. That includes healthcare providers, faith community, and other community advocates. Also, the Detroit Initiative in partnership with the Oakland University to provide access to rehabilitation care and survivorship education for Black women in Detroit. The community partnership with the National Association of Black Physical Therapists and Sisters Network Greater Metropolitan Community. Reduced financial barriers to care, including financial assistance, complementary and reduced free programs. And again, the prospective surveillance model of care so that all patients receive ongoing, tailored, and precision rehabilitation and education care. Next slide. This is the model of the prevalence surveillance model of care for women with breast cancer. It was led by the American Cancer Society, and Turning Point was part of the 5-member steering committee, that created the care. It consists of preoperative rehabilitation assessments, early post-operative rehabilitation assessments through ongoing surveillance. Next slide. Again, I would like to reiterate that it is my distinct pleasure to be included in this critical conversation. But more importantly, I am honored to be among our panelists this evening. Our panelists are women who have survived the journey of breast cancer and who are advocates for equity and inclusion care in breast cancer survivorship. During this forum, our guests will reflect on their own experiences and how they relate to the focus of the previous 3 forums and how it's not just a notion, but it is a critical need to improve the survivor disparities in breast cancer. I ask you to join me in welcoming our panelists this evening, Crystal Gross, Joy Jenrette, and Tia Tomlin. You ladies would mind joining me?
Yes, we are here with you.
Thank you so much. Thank you so much. I need to change my view so I can see your beautiful faces. There you are. Thank you so much for joining me. I'd like to welcome you ladies and congratulate each and every one of you on your survivorship. And I'd like to thank you again for lending your voices to this critical discussion. And we'll start with a brief rounds of introduction. And I'll begin with you, Tia.
Hello, everyone. My name is Tia Tomlin. I am a triple negative breast cancer survivor, 5-year survivor. And I am also the co-founder of My Cell Matters. We're a nonprofit organization in Atlanta, Georgia, that provides support to those that are living with and thriving beyond cancer. I'm also the founder of the My Breast Years Ahead Sisterhood as well. We are over 550 women in Atlanta that are thriving from this disease.
Oh.
Thank you for having me.
Thank you for joining us. Joy?
Thanks, Consuelo. So everyone, my name is Joy Jenrette. I'm from Atlanta, which is why I was rooting Tia on. I am a 13-year breast cancer survivor and now thriver, and a metastatic breast cancer advocate. I was first diagnosed with early stage when I was 25 and had a recurrence when I was 30. The recurrence was early stage as well. And then at 36, I was diagnosed metastatic, which was about 3 years ago. And also as we go through some of the questions, I've also have the BRCA gene mutation from my father's side. Similar to Tia, I've had hormone positive breast cancer for a majority of my journey, but now I also have triple negative breast cancer. When I was diagnosed with MBC, I learned so much more about the importance of self-advocacy, and especially when it comes to quality of treatment, because it varies a lot, and it definitely relates to the disparities. And I've been working with a lot of different breast cancer organizations, but I'm excited because Turning Point, I'm excited about this forum because Turning Point is just a fantastic organization focusing on survivorship, and especially as being a past patient and past board member for the organization. But I was excited to listen to the previous forums and excited to give feedback here. And just to give a little bit of insight, I've fortunately have had really good insurance throughout my journey because I've worked in corporate America, but it's also taught me how to, ask a million questions about my medical treatment as well as my survivorship, but not everyone has done that. Or can do that. And so one of the things that resonated with me during these series is how to meet the patient and their families where they are. But I don't just have breast cancer. I'm a wife, daughter, niece, sister, friend, godmother. So all of my family and friends are impacted by my journey. And I think that is for everyone, no matter who they are and where and what their situation is. I'll stop there, but thanks, Consuelo.
Oh, thank you, Joy. When we think about the word survivor and thriver, I'm glad you said thriver, because all of us are thrivers, and everyone who is going through this journey is a thriver in the fight. And your voice and your advocacy is tremendous. So thank you so much for that introduction. Crystal.
Hi guys. My name is Crystal Gross. I am originally from Miami, Florida. I am new to the Atlanta area. so new to where I relocated 2 months prior to my diagnosis. So this was a journey learning the city and dealing with breast cancer all at the same time. Because I was new to the city, I, unlike Joy, did not have insurance. So I went through the healthcare system of good old Atlanta, Georgia. So I know firsthand how that experience was not the best. And I am a newly titled survivor. I just finished my last chemo in July, which was a little over a month ago. So I just joined the club, thank God. And I'm happy to be here. And thank you guys for inviting me.
Well, welcome to Atlanta. Even though I'm not there. We are more than a club. We are a sisterhood. So I claim you as my sister in this
Thank you.
journey and beyond. So thank you all once again. So we're going to dive into our questions immediately, because I know we have a lot to share of our experiences. So I would first like to ask, breast cancer diagnosis deeply impacts mind and body. And I think sometimes our own experiences as women of color is quite different than our counterparts. So when we think of racial bias, when we think about feeling unheard, a lack of relatability, cultural competency, there's a myriad of things that we can say that's what our experience was. Tell me how that impacted the support you received for these physical and emotional issues during and following your treatment. And I'll start with Joy on this one.
When I think about the side effects that impacted my survivorship, one of the things that I was fortunate to have is I remember, especially when I was in early stage, I had a mastectomy. My plastic surgeon told me to walk the wall, and so I walked the wall. And but luckily, my roommate at the time was she was getting her doctorate in physical therapy, and Jill and the Turning Point team was there kind of teaching them about how to do breast cancer focused, PT. And she told me about Turning Point. And so then I went back to my doctor. I was like, have you heard about this Turning Point or specific, breast cancer rehabilitation? And he was like, kind of like, no. He was like, but you can go wherever you want. Here's a list of the, typical PT providers that he gave me. So luckily I was able to get that care. But when I think of other women, historically are the Black community, number one, and it's, they're reluctant to complain about side effects. Women kind of shrug them off a little bit. And, shrug them off as, because they've, used to dealing with different pains and just, hey, they just kind of become complacent. And they just underestimate how much mental and physical therapy that you need throughout both your treatment as well as throughout survivorship.
Yeah. Walk the walk. I wouldn't even begin to understand what that would mean, especially coming from a physician when you are speaking with a patient who has just been diagnosed with cancer. What does walk the walk mean? And would you actually say that, or do you say that to every patient that comes through your doors with a diagnosis? To me, there's that level of empathy that's not there. But Crystal, tell me a little bit about your experience. Crystal, you're on mute. That is not going to be our theme for the evening. You're on mute.
I feel like I was directly affected by not only the feeling of being unheard, but with the racial bias as well. When I reflect on it, the most important, I guess, memory that comes to mind is I was grateful enough to have, I guess it's bittersweet, my aunt is actually battling cancer as well in Miami. And we coincidentally were on the same exact treatment plan. We went the same day, same days of the week. It mirrored each other. And thank God she had been going through chemo for quite some time, and she had built a bond with her oncologist, and he kind of became my second oncologist, so to speak. And I remember my side effects were so horrible to where I could not move for days, even well over a week. And I would explain this to my medical team and explain how I was feeling and all of that. And I was given the option of just taking ibuprofen or Tylenol. And I would try, and I told them it's not working. Like, I'm really incapacitated. I can't function. And thank God my aunt was able to talk to her oncologist. And mind you, my aunt is white. I guess I should add that part in. So she was able to speak to her oncologist, and instantly her oncologist said that's not okay. Tell her to ask for a lower dosage. They can do that. So I went finally, after weeks of experiencing pain, and I went to my oncologist and said, are you sure there's nothing that can be done? I literally can't take this. If this is what I have to deal with, I'm gonna have to tap out, because there's no way I can handle this. And he was like, well, I mean, that's pretty much the only option. And I said, well, how about lowering the dose? I've heard that, that could be, a start. And he looked at me and said, well, yeah, we can do that too. And I was baffled. I couldn't believe that there was never even an option. It was never brought to the table. And when I say I was in pain, I literally just remember being on the couch moaning for days. Wow. Because I was in so much bone and joint pain. I couldn't do anything. And I expressed that, and to know that those options weren't even given to me after expressing the amount of pain I was in, I realized from that point on, I needed my aunt and her team to help me and to sort of help me advocate for myself up here, because I didn't know what to ask for. And I knew there was definitely racial bias going on with the amount of pain that they thought I was able to, to deal with. And it was a lot. I definitely dealt with that in multiple ways.
Crystal, it's ironic that you preferenced the piece where you said my aunt is white. Now, this is just me, but when I think about your journey and no one offering you the option to having a reduced dose, or in any other option that would relieve you of that sort of pain, that goes back to, reluctant to complain, because we don't know what we don't know, but we have to have that voice to express our own issues, and, as you say, advocate for yourself. But had it not been for your aunt and her team, and I hate to make that contrast, but would it have been different? Right. I'm grateful that you had someone to go through that journey with you, because most of us, and I'll speak for myself, I won't even say most of us, do not have a companion to walk this walk with us. And it's difficult, but I'm grateful that your aunt gave you this suggestion. But that is one of our side effects, just being reluctant to speak about it, reluctant to ask the questions, because we don't know what we're capable or should be doing as an advocate or a breast cancer patient. Tia, can you tell us about your experience?
Sure. My experience was similar to Crystal's. When we think about racism, it's not always in your face. So sometimes we get asked that question, do you think your experience was centered around racism? And I would say, no, I didn't have that experience, but I recall a time when I was dealing with pain, same thing as Crystal, while I was on a particular chemo drug, and it was really causing me bad pain to the point I could barely walk. I mean, I was using my father's walker. I was in a wheelchair at one point in time. And I kept telling my doctor, I'm in pain. And it took them actually 2 weeks for them to get me to pain management. So whatever, the course of treatment that they were using, which was pretty much over-the-counter drugs, was obviously not helping. And I kept saying, I'm in pain, and I felt like I wasn't being heard. And it wasn't until my mother stepped in and said to my doctor, what do you hear when my daughter says she's in pain? And that's when we then got the help that we needed, or I got the help that I needed. And I say we because it affected my mother as well, who was my caregiver. Sure. And so, when I look at that situation, it was disturbing. I mean, it really was mind-boggling that I suffered for 2 whole weeks. I mean, I would sit in the tub for 5 hours at a time, just turning on hot water to try to just give me temporary relief. I would have heating pads on my legs and, you know, a heating blanket. Of course, you know, that doesn't help when you're going through the hot flashes. But, you know, it really, really was disappointing to me. And it, you know, it made me question, okay, am I experiencing the bias that you always hear about, that, you know, some providers think that, or non-Black providers think that Blacks can tolerate pain. And I started to feel like, is this one of those, you know, is this that case that I'm experiencing right now? And it also not only affected me physically, but even mentally, because it made me start to question the quality of care that I was receiving. And what is that going to look like moving forward?
Absolutely. You know, you made mention of your mother and co-survivor. So my co-survivors, as I was going through my journey, there was so much I couldn't even explain. There was so much I felt like there's nothing you can do, and they feel helpless, and their helplessness makes you feel helpless. So then there's that whole path of you're going down this whole path of depression, because it's like there's nothing I can do. And you hit the nail on the head. What impacts you impacts them, and then you have a circle of hopelessness sometimes, until someone comes along and they pull everyone out of that, whether it's your oncologist, you know, your team, your navigator, someone else who's experienced the journey with you. It sometimes takes that outside person to pull us all out of that, because I can't say it enough, we don't know what we don't know. So I'm gonna move on to question number 2. In the first forum, we talked about the causes and impact of racial disparity in breast cancer survivorship. There were some very strong statistics in that form, and one of them that resonated with me, or really spiked my interest in learning more about, was the 50% of minority cancer survivors who are not receiving care in accordance with the National Comprehensive Care Network. Can you reflect on any of the things brought out during the forum, and if they resonated with your thoughts and experiences? And I'll start with you, Tia.
Yeah, you know, that stat was very alarming to me. You know, it made me really think about the standard of care. You know, even thinking about my own journey, did I receive standard of care? And what really is standard of care? Most of us don't know what standard of care is. You know, you ask anyone who's going through treatment, it's like, I've never even heard of that. What is that? And what does that mean? I didn't even know there were certain guidelines. I mean, this is something that's new to many of us. And so that really stood out to me, because when we don't know, and again, this goes back to health literacy, when we don't know, it puts us at a disadvantage. So in those instances, we really can't advocate for ourselves, not only during treatment, but even in post-treatment, in the survivorship. You know, and this is why patients often tend to connect with other patients and other groups, and even trusted entities within our communities. We look for those because we need that guidance, we need that help. And so when we think about the survivorship and how, you know, standard of care does impact even post-treatment, we don't know what to ask. I mean, oftentimes when you're finished with treatment, it's like, you're done and I'll see you in 3 months. But, you know, how are you helping me, you know, rebuild my body and rebound? How are you helping me to be preventative or lower my risk of a recurrence? And so these are things that, you know, when I think of the standard of care, this is something that really stands out to me when it comes to, you know, the impact or some of the causes around the racial disparity, because we don't know what we don't know. And so we're at a disadvantage.
And when you say the standard of care, is that different across the board? Our standard of care, in my experience, is much different than my counterpart. It was different than my counterparts. There was a lack of empathy. There was a lack of information, a lack of education. There was a lack of being in the room with people who looked like me. But it wasn't the same for my counterparts. So, Joy, can you give us an example of your experience?
I would say when I, especially from the first forum, one of the things that stuck out to me too is around, you know, knowledge, right? And really around like family history. So I mentioned in my intro that I have the BRCA2 gene mutation from my dad's side, you know, kind of keeping that in mind. You know, my parents divorced when I was 2. You know, my mom lived in Atlanta. My dad's family lived on the West Coast. And one of the, and no one on my mom's side had any breast cancer, but on my dad's side, there was lots of family members with breast cancer, and other reproductive cancers like prostate as well. And, it's sad that I really kind of found out about the pervasiveness of the cancer, after I was diagnosed with early stage a little bit, but then I really found out about it more, it's probably because I was now older, after I was diagnosed with metastatic. And and then even other family members would comment, probably from her mom's side or blah, blah, blah. And I tell this story because, we don't know or even share our family health history, and we avoid talking about it. So I'm not sure how to make the community or make people more comfortable with discussing their health history, but at least we can kind of start with our, as a survivor, as an advocate with our own families, this is what my understanding, this is what I've learned through my journey of our family history. And it's, and that's kind of, so what this means is we may need to get screening early and kind of translate that to not to drive fear, but to drive knowledge of what they need to do as preventative, before they get these types of reproductive cancers.
Yeah, I agree with that. And I also agree with knowledge transfer. So when we think about the standard of care and how that affects us through survivorship, some of that is exactly what you just mentioned, knowing your family history, having those open conversations about what's going on within your own family, within your own community, and being a trusted voice. So that knowledge transfer will help in our own standard of care, because then we have an arsenal. Now we know what to go and ask about. We're knowing what to inquire about, and we're knowing what to demand as advocates of our own health. So Crystal, can you tell us what resonated with you out of Form 1?
Yeah, for me, what resonated the most was knowing the numbers and the disparity, the lack of the being proactive from the physician's standpoint. And I understood that so much because my story is so different, because I didn't have insurance. I went to the clinic, and my story was I actually found my mass myself in my breast. And when I went to the clinic, mind you, I couldn't get an appointment, the typical low income area in Atlanta, you have to wait, and all of these hurdles you have to jump to get an appointment. And I go in, and like what Joy was talking about, I actually know my family history, and breast cancer is very prevalent in my family. So not only did I tell the physician that, I told her, I was a little concerned because I felt something. And the main thing was I gave her the opportunity to check herself, and she didn't find anything. Not only did she not find anything, eventually she asked me to point it out to see what it was I was concerned about, and then kind of brushed it off. And then I was, pretty adamant, let's just double check, let's take the next step. And she even went as far as to not wanting to refer me to a mammogram. Mind you, I had a mother that's tested positive for the BRCA gene. I've had a grandmother who had a double mastectomy, an aunt who passed away from breast cancer. The list goes on. It's very, very prevalent. So with the physicians knowing this, and I'm feeling something that's a little abnormal, and she agrees that it's abnormal, but still doesn't even want to take the proper steps that you would normally take to be proactive when a patient comes to you with these concerns. And I couldn't help but wonder, if I had private insurance and I was at a private practice, would I be going through this? Would I have to be more assertive as far as demanding the next step in the process? Because it's clear that we both feel a lump that shouldn't be there, and we both know how my family genes are so, the genetic, how strong it is in my family. So knowing both of those things, you would think it should have been without a doubt, okay, the next step here, we're not going to waste any time. This is the plan of action. And it wasn't that at all. And I couldn't help but to think, why wouldn't they be more proactive? Why wouldn't they take me a little bit more serious, knowing these numbers, knowing the statistics? And unfortunately, I was, I was part of the statistic. I was definitely swept under the rug, and they were not trying to be proactive in the least bit. And thank God I, took it to the level which I did to, get it as soon as I did in the stage. But still, it was alarming. I couldn't help but to think if I was at a private practice, I wouldn't have dealt with that.
Well, not only that, there was a statement made by one of the panelists in that particular forum, and we talked about patients being equitable and not equal. That's where you go to meet us where we are. You don't know our financial situation. That's that financial toxicity. You don't know our mental situation. You don't know our family history. You don't know me. You look at me and you have a conversation that I may not fully understand. There's no one here to assist me, and I'm scared. And those are some of the things when we think about racial disparity in breast cancer, that comes along with all of that. You have to meet us where we are. And when I think of statistics that are published, the 1 in 8, or the survivorship statistics around Black women versus our counterparts, to your point, Crystal, take that in consideration and let's have a different type of conversation, because we have a different circumstance. We have a different situation. We get diagnosed differently. We have a higher mortality rate due to diagnosis. And if a physician understands that within itself should usher in a different type of conversation. How about inquiring about your family history? I've never once, with the exception of my oncologist, has someone really talk to me about my family history. My mother passing away of triple negative breast cancer. It's just the basic standardized question, does anyone in your family have cancer?
Right.
So it took a navigator in my oncologist department to really have that in-depth conversation with me. She was invested in me, not the disease. She wanted to learn all that she could to help me on my journey. Frightened, young, had been a co-survivor, but during that particular time, didn't fully understand the impact of breast cancer, and surely didn't expect to be diagnosed at the age I was. But it wasn't the team that helped me. It was my navigator who helped me. And had it not been for her, I don't know that I would have come out of this on this side now, being such a strong advocate and knowing that we have to be the voice of these women who are voiceless. So thank you all for sharing that. We're going to move on to our next question, which is just a follow-up to this. A follow-up to how this resonated with your thoughts and your experiences. But within that form, is there anything that was missed? Anything that was failed to emphasize with respect to the causes and impact of the disparity, in your opinion? Was there anything that could have been further discussed or highlighted within that form as you think about the experts that sat on that panel?
I think for me, one thing, and I didn't say my age. I am 35 years old now. I was diagnosed at 34 years old. And I think one of the main things that I would emphasize more is not only being a Black woman, but age, being young. I'm not by any means young, but in the cancer world, I'm on the younger side of things. Yeah. And being younger in dealing with cancer, I feel as though I wasn't taken seriously. I feel as though I was approached just be more so as a younger person, with the lack of knowledge, with the lack of seriousness, just more so moving it along, like definitely not taking into consideration my voice, my opinion, my feeling on things. I definitely feel like that was that amplified being a Black woman, being a younger Black woman. Okay, she doesn't know what she's talking about. And I just feel like age also plays a major role. And I don't feel like that's emphasized enough. Like, being a younger Black woman, I feel like I went through even more of a difficult time because of the correlation that age has with seriousness to things, and just, taking advantage of the age. I think that was one of the main things that I think I could emphasize more with with the disparity.
Okay. And
just to kind of piggyback off of that, Crystal, I was diagnosed very young too, right? At 25. And and it, came back. But one of the things is that, based upon your experience, if you just said, hey, I'm just gonna to take their word for it, it's probably benign. And that's what, when I was first diagnosed, they told me that although there's a complex cyst in my breast, it's probably benign, is what they said, probably benign. And so luckily, my mother and and obviously for myself, she's like, I don't care if it's probably benign, take it out, because we need to know whether it's, we need to confirm. And then, it was, unfortunately it was cancer, but if I had gone on with that assumption of it's probably benign, your age and blah, 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 I would have not gotten, it would have gotten progressively worse. It was, early stage. And then you hear the statistics that, Black women are diagnosed, number one, they're getting breast cancer earlier. And then number two, they're getting it earlier and it's at later stages. And it's because of this, this bias. And it's because of that, which is really kind of driving those statistics. So I completely agree. I hate that it happened. I mean, in your case, but it's happened to so many other women too.
I believe it. I actually am so thankful that I've been on my own and I've left the house so young, and I've been going to doctor's appointments all my pretty much over half my life by myself. So I knew what to ask or how to research or how to advocate. Because some people don't know that. Some people have been going, usually have their mother with them or a parent with them or someone that can. So I'm thankful that I've had the experience to where I knew, like, okay, this is serious and you need to approach me as such so we can, can conquer this together. Because I can only imagine people who never dealt with going to doctors or serious issues where they needed to ask questions. I'm sure there was plenty that I didn't know, but I at least had a little advantage of, being my own advocate thus far, thank God, because if not, I know it would have been even worse.
Yeah, and having that adult conversation, sometimes when you're young and you're in front of a professional physician, they don't understand that you completely understand. It's just like throwing words at you, having a conversation, quick in and out, and hopefully you'll catch up on the back end. I'm not saying that that's the, everyone's experience, but that is a lot of what happens when you're dealing with young patients and older physicians who deal with this kind of diagnosis all the time. And Joy, in the famous words of James Brown, I know he says, Papa don't take no mess, but I'm so glad Mama didn't take no mess. And she said, get it out of my baby, because we're not having that. So thank goodness for the advocacy from her. I'm gonna move on to our next question, question number 4. In your experience, let me back that up. I won't say that. In the second form, this is my favorite form, of course, because I was on the panel. In the second form, a number of community-based and national strategies were discussed that could potentially reduce racial disparities. And one of the golden nuggets I took from that form was the 5 dimensions of access to care, which is considered the 5 A's. So you think about approachability, acceptability, availability, affordability, and appropriateness, and how that actually affects or impacts us as people of color. How approachable are the clinics that we go to? Are they inviting to us as people of color? How acceptable? How do they accept diverse, and how are their service deliverables? So the 5 A's, of Jill, if you have that link that you can provide to our attendees, I would like for you to provide that link, because I want them to understand how the 5 dimensions of access to care are really critical when you think about service and service to minorities. To the panelists, in your opinion, which strategies are critical to be enacted immediately and reduce disparities? There's all sorts of strategies. I just gave you an example of one. But in your opinion, what would be the most effective strategy to enact and implement to reduce disparities?
So I'll go first.
Sure.
One of the things that really resonated with me is the collaboration and partnerships because, you guys are local, organizations.
Yes.
And as a breast cancer patient, or survivor, thriver, the community organizations have the most connections with the community itself, understanding what their needs are and what's needed to get community engagement, so they can get access to the different resources that's available to them. That's in connection with that's also in connection with the community goals and also the organizational goals and impacts. So like your social media, but also like, how do we get more digestible health education and content to the community? How do we meet them where they are, so they are not, they're not hearing about breast cancer, for the first time when they're diagnosed with breast cancer. They're not, they know that information, they know what to look for in both themselves, but also, their family members, so that they can help their family members.
Right.
But I'm also going to kind of toot Tia's horn a little bit here.
Exactly. I was getting to you, Tia, because you got, how many did you say? 500 strong and counting? We're going to say and counting, but yes, absolutely, Tia. Time to shine, sis.
It's not just her. She has created lots of great networks and obviously groups of communities around virtually, as well as kind of within just with like in person, like just so many different networks. And I'll just kind of give you an example. And her organization, My Cell Matters, she partnered with a for-profit Black-owned business called Eat Right Atlanta. So both in Atlanta, to deliver like food to fight, like farmers boxes with like lots of fruits and vegetables for people in the Atlanta metro community who are impacted by cancer or going through treatment. And the reason I want to kind of highlight this is like, Tia has so many different focus areas when it comes to like health and understanding like, impacts in the, Tia, and I'm probably saying this wrong, of like different chemicals that, different types of like ingredients in certain products and things of that nature. But what she's kind of carved out here, at least for this initiative, because she has definitely other ones, is just how do I connect my cancer network, with her organization and connect them with another organization where they, connect them with another organization where both of them are benefiting. So, her organizations, they're getting these boxes. And then also, this Black-owned business is also getting it business as well. So I feel like it's like both, from kind of two perspectives, and everyone is getting nourished. I mean, health education,
right,
as well as kind of finding out, as well as actually getting the food itself.
Right. Well. And building a network. And that's what we need. We need a network of providers, community leaders, and community organizations. Tia, it's nothing like having someone speak so kindly about you. That speaks a lot to what you're doing. It's an amazing accomplishment and compliment. Is there anything else you want to add to that?
Yeah, so, to piggyback off of what Joy was saying, just thinking about community serving community, right? We're not only supporting the cancer survivors in our community, underserved communities, but we're also addressing social determinants of health, food insecurity, especially with COVID. A lot of people, especially cancer survivors, were afraid to get out, go to farmers markets, get fresh produce. And so now we've partnered with another small business, Black-owned business, to help them with, boosting up their, economic abilities within their own individual community. And we're also able to help the patients that we serve. But I will also say, to kind of add to, or to address the question rather that you were asking, I think also when we think about health equity, we're not talking about just giving people the same thing, right? We're talking about giving them what they need so that they can reach their optimal health. And so when I think about that, I think about even our patient navigator programs.
Yes.
Oftentimes, especially in the rural communities, they don't have these programs. And these are so essential to health equity. We want to make sure that people get what they need. We are more than just cancer, right? We're more than just people
Right.
living with cancer or thriving from cancer. But, if patient navigator programs don't exist, then I think they really need to consider starting one. Or if they don't have the ability to start one, then connect with a local CBO like ours, or your organization. Connect with these organizations that have the resources and that can help put patients, especially patients that look like the community, right? Put them in contact with the resources that they need, because we understand it, and sometimes
Right.
when you're not in those shoes, you really don't understand the needs and the urgency of those needs. And then I would say for those that, with the patient navigator programs too, if you do have one, don't just check in with the patient at the very beginning when they're first diagnosed. And then, if the patient doesn't respond, then you just kind of
Right.
walk off from them, right?
Sure.
We are inundated once we hear it's cancer. You have so many things going on in your life. Life is already going on around you. Now you add, you've been diagnosed with breast cancer. So we really need to make sure that with those programs, you consider checking in, having checkpoints throughout their treatment journey, and even pulling in the provider, because they have a role to play as well, to just ask the patient, not just the general, hey, how are you doing, and move on to the, let's talk about how we're going to treat you today, but how are you really doing? Let's have
Right.
a moment to just, let me ask you, what can I help you with outside of your treatment? What are some of the things
Yes.
that you may be challenged with that we can help break those barriers down? And when you do that, that helps to build trust between
It
you and your
does.
patient. And I
Right.
think those are some of the things that we can do as a community, patient, provider, and CBOs, to help to reduce those disparities.
No, that's a great response. And I like that you mentioned navigators. So within Kansas City, we have a community college who has actually had a program to help educate community navigators. And that community navigator can serve, from a cancer perspective, from other disparities, whatever. But just having that sort of partnership outside of the service partnerships that we have with our other organizations, the community colleges offer that sort of certification. That is helpful to the CDOs, like you've mentioned, to all those organizations and community organizations that need navigators, boots on the ground, grassroots, to help with our patients throughout this entire process. When you think about the rural areas, to your point, who don't even have navigators, let alone service, they have an extreme barrier. They have the transportation, they have the access to care, of course, education, all of that is factored into that. So that navigator who can come in and help, they're not being funded right now.
Yeah.
You have social navigators, you have clinical navigators, but those people who can really resonate with what you're going through, it could be your neighbor, it could be the person you grew up with on the block who has an invested interest in you personally, that's going to help you through that whole situation. Like Crystal, you mentioned you're in Atlanta by yourself, but what if you had that navigator who was just connected to you and wanted to see you through that entire, it makes such a difference. And when you think about survivorship, huge. When you think about survivorship, that is a key component to it. That is what I would like to call from the porch to the process and beyond. And imagine me saying that in my Buzz Lightyear voice, but from the porch to the process and beyond, that's where true survivorship resides.
Yeah. And Consuela, I just want to just add one more thing. We just have to remember that 80% of what happens to us when it comes to our health happens outside of the clinic.
Absolutely.
So the patient navigator is going to be the one to help us to address those issues around social determinants of health. If you're dealing with transportation issues, you're dealing with, I can't pay my rent, I can't feed my family, breast cancer is not a priority. And
That's
so how
true.
do we help you address those barriers so that you can get the quality of care that you need and you deserve?
Absolutely. That's spot on. Crystal, is there anything else you wanted to add to that?
Actually I did. I agree 1,000% with the community-based relationships that helped me tremendously. These programs, Turning Point, like literally they're everything. They give so much empowerment to you, like outside of, the medical office, like Tia said. For me, one of the, or two of the A's that resonated the most with me was appropriateness and affordability. Obviously coming from the place of no insurance. First of all, appropriateness. And one of the examples I have was actually dealing with my oncologist and having conversations and them just saying the most inappropriate things as though it was so normal. And I think that's something we definitely have to go back to the beginning, just the fundamentals of how to interact, like being appropriate in times when, or being able to empathize, being able to understand when things are appropriate to be said. For example, I had to freeze my eggs because I knew chemo and, you know, all the effects of chemo. So freezing my eggs was one of the options that I was given. And I actually had the oncologist say to me, well, why would you freeze your eggs? Your eggs will have cancer, the genetics will be in the cancer, in the DNA too, right? Well, what would be the point of saving them? I mean, I don't know. If you want to, you can. What do I know? This is my oncologist. And if that wasn't the most inappropriate, and this is my first meeting with her, so I didn't know how to take it. I didn't understand why she would say it. I obviously didn't know anything about the egg freezing process, so I didn't know whether she was right or wrong. But it was so inappropriate for the initial conversation to just say, well, you have breast cancer and the cancer gene, so the probability of the child having it would be great, so why even have one? So appropriateness, 1,000,000% resonates with me. And affordability. I mean, every single office you walk into, the first conversation is money. It's money. It's going to, and with the egg freezing, that was what the first conversation. So this is not covered. Insurances don't cover this. So if this is something you want to do, this is out of pocket. And yeah, it starts at, at least about $8,000, $9,000, $10,000. And it's like, whoa, like it just comes at you so quick and so fast, and you don't know where to go. You don't know that there's, foundations and programs that can help, supplement a little bit. I mean, anything helps at that point, but affordability, it's one of the biggest gaps and the biggest things that we need to connect with, and being able to just understand that a lot of people don't have the resources to be able to afford care or anything extra. And egg freezing is considered extra. It's not even considered part of your primary care, but in the grand scheme of things. But that's definitely something that we need to attack, and we need to understand why these prices are so astronomical, and how we can bring it more affordable into our communities. Because once we hear large sums of money, the first thing we do is
we shut down.
We can't do
we
it.
Shut down.
I have no hope. There's no way I can do this. So you don't even accept what can potentially help you, because you're so eager to push it off, because it's more than what you can afford. And that's one of the things that resonated most with me, is affordability.
And then you don't want to burden your family. So it's just a trickle effect.
Or anyone.
Or anyone, exactly.
And a lot of people don't like to ask for help. So it's like,
they don't.
Oh, I have to fill out a form just, to show that I don't have the money, or that I do need a little help. And it's not easy. It's not easy.
No, it's not. It's not easy. And it's a trickle down effect. And I think we touched on this earlier. What impacts us impacts those who are helping care for us. So wow, thank you for sharing that. That's the eggs freezing thing. That just blew my mind. It's like inappropriateness and all of that. It's just, wow. This is not funny, but sometimes I have to laugh.
It's
crying.
So
That's you have to laugh to keep from crying. So with our last question, in your experience, what recommendation would you give to healthcare providers as far as better supporting the physical and emotional survivorship needs of Black individuals going through breast cancer treatment and beyond?
Well,
I know take that one, Tia. There's a lot we can say about that, right?
I'm like, the advocate is rising up in me, especially after what Crystal shared. Oh my gosh,
after that,
compassion.
We're gonna tell you what you can do.
Yeah, right. definitely show compassion,
Absolutely.
and again, I go back to, you got to take time to get to know us beyond our diagnosis, help us to be proactive. And that's one of the big things that I see, even with my care team. It's like, I don't feel like they're being as proactive. It's kind of the routine test. You go, you get your blood work done, but how are you helping me, especially when I first completed treatment, how are you helping me to be proactive and also helping me to recover? Like, we know that there are long-term side effects. As a matter of fact, one of the studies that was shared early on, and I don't remember the numbers, but they said there was a large number of women that were experiencing long-term side effects, and they weren't really saying anything, right? Because you don't know what you don't know. So it goes back to health literacy, right? So again, meet us where we are, some of the things that we talked about earlier, and really help us to just be proactive. Show us that you care about our recovery. Don't just make us feel like you're just waiting for the shoe to drop on the other foot, right? That we have a recurrence and then we come back and now you just care for the cancer all over again. No, care for me as a human being first, right? Provide us with the evidence-based resources that's going to help us in that recovery. And they have to remember, they're the experts. We're the experts when it comes to our bodies at some point, right? We have our own PhDs, our personal history with the disease, but they are truly, truly the experts that we really rely on to give us the information. We don't know everything. We're not going to tell them everything because, again, we simply just don't know. Right. And we just think it comes with the territory, but we don't know that there are remedies for certain things, especially when it comes to sexual health. But I'm not going to get on that topic for long because that's a whole nother subject. But you hear a lot of women that are experiencing these types of things in survivorship, which then affects their relationships and their families. So, the doctors and the providers should not wait until we have to speak up. They should be forthcoming with the information, especially when they know. I'll give you an example. Taxol, we know is, now I know, I didn't know then, but it's one of the drugs that highly affects Black women when it comes to neuropathy, right? That's something I would not have known, but you just go with the flow. And now I'm dealing with that. Here it is, I'm 5 years out and I'm still dealing with it, but give me the tools and the resources to help me, to overcome the neuropathy. So, I'm just thinking, we've got to find ways to really be proactive instead of reactive or waiting for the patient to be forthcoming with their information.
Tia, I really agree with that because, I feel like we interpret information differently. Everyone not interpret or digest it differently. And I think the doctors need to kind of understand that, you have to hear what the patient is saying. Their voice is most important. And as you're going through all the different types of, treatments and, outcomes, you need to kind of step back from a minute and kind of put yourself in their shoes and make sure that they understand what you are saying. And I look at it like, do a mental check. You lay all this stuff out. People are like, they nod their head. You understand? Yes, yes, yes. But, can you go back to them and say, tell me what you understand from what the options I've laid out? How does this make sense? Having them repeat it back to you in their terms, right? So that it's clear that they got it, right? Because I think I think doctors take a lot of things for granted, like no matter what your socioeconomic, your education level is, or anything, your race or any of these disparities or any disparity, it takes things for granted that you understand, that you somehow went to medical school, behind their backs and their own side. And, and so I really feel like, as you deliver, the clear information, obviously the different drug names and all those things and why you're doing it, I feel like you need to go back to them and say, tell me what you understand from what I told you, because people will always say, yeah, I got it. Okay, when's my next appointment? When do I have treatment? Blah, blah, blah. But I really think doctors need to take the onus to do that. and potential that goes with side effects and those things. Because I'll just say, just give a last like another personal story that really hurt my heart, but it hurt my heart more because I felt like my cousin her life could have been extended if she had known more information. And so my cousin, she was really reluctant to kind of, ask for details from her doctor, because I had to go back and forth with her over, what's your diagnosis? What's this? What's that? What are they asking you? And she's like, I don't know. And I'm like, how can you, I was like, well, how do you not know this? Because I look at it as being basic information. But, from her perspective, she lived in Las Vegas. And so she finally came back to me and said she was diagnosed with, stage 3, and, and told me, she was BRCA negative, blah, blah, blah. But what happened is that, I don't think her immediate family knew what stage 3 meant. I don't think that even my cousin knew what that meant. So she abruptly passed away because she kept, shrugging very common side effects of metastatic disease off and symptoms, for weeks, and didn't report them to her doctor. And her family didn't know what to look for as well, so they, she's like, I just need to sleep. I just need to. And so she didn't recognize that her cancer was progressing and, had moved to stage 4. And I feel like if her family and her could kind of recognize, hey, these are not just, oh, I just need to sleep situations. You tired. This is, you need to go see the doctor. And I think that's the other piece that is missing is, how do you educate both the patient and their support people and family to recognize when they need to sound the alarm, when they can't wait to the next 3 months, those type of things. And my last point will be around palliative care, especially from the perspective of NBC. And palliative care, it's not about end of life, specifically. It's more so how do you manage different things. And I bring this up because Tia mentioned the sexual impacts. And palliative care helps you with those types of things to navigate through different symptoms, or side effects, whether it be pain, whether it be fatigue, whether it be, anything like, sexual situations. It kind of goes through a lot of the things that are impacting your quality of life. And I think a lot of people don't tap into that as part of their survivorship either. Sorry.
Right. You brought up something. Go ahead, Crystal.
Sorry. I just actually wanted to touch on what Tia said. Well, both Tia and Joy. To start off, in regards to what Joy said, it was funny how you said that you were asking your cousin all these questions and she couldn't answer them, and you were kind of like, well, why do you not know, or how do you not know? And that was me to everyone asking me, well, what kind of cancer? Was it hormonal? Was it positive? And it was just like, I don't know. I didn't know. It was information overload. And it was like at a certain point when you get these diagnoses and you sit down, you kind of stop listening after a certain point because it's so much information to consume. And now during COVID, unfortunately, I'm doing all these appointments alone. One person can only take so much, especially when you're the direct patient. You just tend to kind of like black out. And how Tia said, ask me, do I understand? And reiterate to me what it was that I said. Yeah, you sent me home, perfect example, with a whole binder of things, but I was already depressed enough when you gave it to me. So you want me to open up this binder
and read more about it,
of all the side effects of how I'm just going to die. And it was a lot. And I never want to take away from the from the physicians because they were all amazing. And I mean, none of us would be here without them.
Right.
However, I do understand that it comes a time where they're desensitized. And I feel like it's become a routine for them and they're so overworked. There's so many patients. To sometimes they forget, sit down and empathize with us and be relatable and talk to us, communicate, just the basics. And sometimes
Right.
I think we strive so much for the end that we forget the foundation in the beginning and the understanding and the
That's
communication.
good.
And I think that's so important. And it you could just see it more in every physician's office that I went to. Even my plastic surgeon. And I was sorry, but can I come and see you before the surgery? She said, well, we've already done a consultation. And I said, yeah, but I didn't ask you, all the questions. Well, what more could you want to know? I was like, well, what
Wow.
size my breasts are going to be? She's like, well, we can't determine that. That would be something once we go in, then we see, oh, okay, well, that was never discussed. I don't know if I was supposed to know that. I had no idea that I wasn't going to know what size I was going to be going in unless, I did the certain, protocols to
Mhm.
lift, to go bigger. So it was little things that it's just so automatic and routine to them that they forget. Us first timers, we have no idea. I like Joyce said, I didn't go to med school behind your back. I have no idea what's going on. This is literally my first time hearing about any of this. And
Right.
I think they do forget. And I understand their workload is ridiculous, but we have to be able to meet halfway and just
Right.
going back to just taking the minute to communicate, to empathize, to ask
There you go.
questions, to relate to us. I
Yeah.
think
Yes.
as simple as it sounds, it will make such a big difference. And
And it
that's just
will. And it absolutely will.
tremendously.
And when I think about that, I'll share just one experience I had, and this comes from my patient navigator hat. So I am a lay navigator with a certification in breast advocacy, and which allows me to sit in a room and be able to absorb the information and convey that to the patient afterwards. But there was one instance where the patient, this was her third diagnosis of the same type of cancer. Same information, and nothing had changed, but this was the first time I was in the room, and she was very distraught, but she's looking for hope. She doesn't want this to be her diagnosis, late stage, but the doctor just kind of read the information as if he was talking to a patient that just had the common cold. And that's what I said. I said, wow, you're talking about this as if it's just a common cold. And he stopped and looked at me and said, and you are? And I said, my name's Consuelo Ross. I am the founder and CEO of Surviving the Eyes. And I read it down to him and he said, I think, he said, you know what? I've heard your name in circles. I'm sure you have, because it takes us to be the voice when you are in there talking to me, like to everyone's point, I've been to med school, or not to even empathize with the fact that this is my third diagnosis. If this is my third diagnosis, that is a trigger, a red flag for hope. This patient does not want to hear the fact that she is stage 4, stage 3 breast cancer, and there's likely nothing that we can do, but we need to progress in this manner. No one wants to, at this point, it's like, tell me something that's positive. And when you have some in the room that demands that of the physician, take it down a notch, meet us where we are, turn on your sense of empathy, and let's approach this in a different way. It changes the dynamic, it changes the conversation. So, man, this has been an amazing discussion. I don't want it to end because there's just so
Right.
much that we can talk about, and so many things that we can do to change the impact of survivorship for women of color. And I thank you, Jill, for the work that you're doing there at Turning Point. And this has been amazing.
So this one was a hard one to come on because this
Yeah.
has been amazingly impactful. Very sad in many ways to hear some of the stories of what you've experienced. As a breast cancer survivor, I too have experienced some of them, but we are here. There is a difference in your experience. We're hearing that, and that's what we're seeing this in the chat box of things that there's many of us on the webinar tonight that are healthcare providers that are listening, and I think we all need to do better. and I include myself in that. We do have a few questions, so you're not quite done yet. They're not in any order. A lot of them were kind of pulled together from the chat room. A couple of questions. This is an easy one. We'll start with the basic one. One of the people in the chat room said, "Whoa, I had no idea that rehabilitation was a thing." Could you tell us a little bit about the impact of exercise and what you did for the physical point of getting back to yourself, or working back that way for those of you who still are?
Okay.
And anyone that you can,
Yeah.
free flow is good.
Yeah, so I'll go. I mean, it really helped me. I was dealing with cording, and the sad part about it is no one told me about cording. I just knew that my arm was hurting. And I remember after surgery, waking up and I was like, I can't move my arm. What is going on? This is hurting me, and I'm like, Mom, stretch my arm. And she's like, I'm yelling and screaming and what have you. So we call the doctor, of course, and they bring us in, and then we start to learn about cording. And it was a little disappointing because I'm like, why didn't I know about these things beforehand to at least mentally prepare me? Even though it's something I may or may not experience, but at least I'm mentally prepared so that when it happened, I could respond right away. At first, I thought I laid on my arm wrong, so it took me a while, but I dealt with that pain, and I could have avoided having to deal with the pain. But once I got to therapy and learned what I could do, I mean, I was able to move my arm and learn how to, have a better range of motion. So it really, really helped me. But like she said, I didn't know about it beforehand. It wasn't until something happened to me, then that's the reactive part and not the proactive part.
Agreed. I mean, I completely agree with that. That's what I meant by walking the wall. And he started with walking the wall, but never really told me where am I supposed to get to, what cording was or anything like that. He just said, can walk the wall as many times as you can. And I'm like, okay, then go to physical therapy. And I'm like, okay. But so I completely agree with you, Tia. And not until I got to Turning Point that, I realized what the possibilities were. Mm-hmm. And really it just helped with that, with the cording and to actually when I had the recurrences and later on, they even like kind of did, especially when we do a remote session, you can do a remote session now too, but my husband came into one of my appointments and they showed, some basics that he could do on me at home too. So I think kind of bringing the family into some of those type of sessions would be, kind of good too. So they can help you out like your mom, right? You're like, hey mom, help me do this. And I don't think that we're, necessarily think about that as well. So.
I agree. I am so thankful for Turning Point. Not like an advertisement, but I'm so grateful. I would have my mom, and I felt so bad. I would have my mom stretch me, and I'm like, they don't do it like that there. They do the way she does it in Turning Point. I can feel it here, and I feel good for the rest of the day. And I would literally try to reenact whatever it was that they were doing at Turning Point to stretch me out and to relieve the pain and it was so helpful. It was nothing I knew I was going to need or that I needed. And once I went there, I was educated on so much of the aftermath, what to expect after, and what's normal, what's not normal, what to feel, and if I feel it, to come back. And it was just, it's a lot. Physical therapy is so important, and it helped me so much. I mean, I'm still going, and I couldn't imagine not going to physical therapy.
And I would say not just physical therapy, but I think you need physical therapy with a focus on working with breast cancer patients, because there's physical therapists out here that anyone can go to. But if they don't really understand the challenges of women who've had you've had breast cancer and even some other, ailments that they may have been challenged with, it makes it even harder, in terms of the recovery. So kudos to Turning Point. I know you were a lifesaver for me.
Yes.
Thanks. That's not why I asked the question.
But we have to acknowledge that. I mean, your services is needed everywhere.
It really is. It really
we need like little Turning Points everywhere.
We need a Turning Point in Kansas City.
ahead. This is a kind of, again, putting together a couple of comments in the chat room. The comment was that when a woman has breast cancer, the whole family has breast cancer. So my question to you is, what do the men in your life, what do the women and families in your life need to know about your journey? We've asked you what your healthcare providers, what you would say to them. What would you say to the men and families in your life?
Patience. I would really say have patience with me, because my husband passed away before I was diagnosed. My journey was my children, myself, and my best friend. And there was so many emotional things going on. My mother passed away of triple negative breast cancer. I couldn't talk about it. I couldn't explain what I was dealing with. I couldn't separate the emotions. I couldn't separate the anger, and it was a lot. And instead of chalking it up to, well, she's sick, but not thoroughly understanding, have patience. If I can't ask the questions, be an advocate for me, because there's things that you don't understand, but it's impacting you on some level. But there's still people you can, if I can't utter a word, understand that where I was at that particular time, I'm not just saying for myself, but everyone, any man out there, it's hard to understand the journey of a woman, period. You know, they say that the woman is we are the community, we are everything, we are the breadwinners, it's everything. And when you get hit with something like cancer, it brings you to a brick wall that you can't go over, you can't go around, you're just stuck. It's like, just have patience with me while I try to figure this out, because we are those who figure out everything. We're gonna get it done, we're gonna get it right, we're gonna figure it out. But give me a minute, and don't disregard what I'm going through. Just sit back in silence and help me through it. Sometimes sitting in silence is the best thing you can do while I try to get a handle on it, so that we can go through this together. So for me, in my journey in that particular time, it was just have patience with me, because I'm gonna figure this out. And until I do, if I'm not good, ain't nobody good. How about that?
Right. Thank you for sharing that. Thank you for sharing that.
Yeah.
I would actually say, piggybacking kind of on Consuelo, patience, but understanding. A lot of people like to give advice, and I get it. It's always coming from a good place. It's coming from love and from care, but it's my experience. It's my life. It's my body. And as much as I know you think you understand, you don't.
Right.
And you won't, because it's never going to be a personal thing. It's always looking from the outside. And I've always had a lot of unsolicited, advice and opinions, and, oh, the hardest part is chemo. The hardest part is removing your breast. My hardest part was going bald. And people were like, really? Yes, it was. So don't tell me what your hardest part is, or what you think my hardest part should be, because we're not the same. So just have understanding, and just, if you don't, silence, like Consuelo, just be there. Just your presence alone is that's enough. And that's kind of what I would.
Yeah, I mean, I would echo. My husband has actually been really great in, just trying to help me know my body, or know the different changes, right? And I think one thing, especially as an MBC patient, is knowing that every day is different. Some days you feel like you can conquer the world, because I'm generally a happy-go-lucky person. So I'm not going around, and saying, oh, woe is me. But I could feel horrible, but I'm not going to say woe is me. And I need you to kind of be there, for when I'm not happy-go-lucky, when you see me be or down, or, internalizing it. And, but, that comes with patience, and just really being my partner through the journey, because it is, like you're saying, it's their journey too, on a day-to-day basis. Whether he has to take me to appointments, whether we have to, deal with whatever the side effects of treatments are or the symptoms from the cancer, he's dealing with it with me, not necessarily in his own body, but he's still dealing with it. And so I would have to say is be patient and know that, your journeys are connected, but you don't know exactly how it feels. You don't exactly know what abdominal pain feels like from, from your liver. You don't know how how shortness of breath feels to like, to kind of, walk from point A, or not being able to walk from point A to point B because you have, shortness of breath. So, and plus everyone looks at symptoms, through their own lenses, of how, how they have experienced stomach ache, or, or running too hard, or that's shortness of breath. So I think it's understanding that my symptoms are my symptoms. And I just need you to just say that, okay, your symptoms are your symptoms. What do I need to do to help you through it? And, what support do you need from me? And you don't always have to say anything or respond. Like there's sometimes silence, you guys are right.
Sit in silence. There you go. End of story. Just
let
it be.
So.
Yeah.
I'm going to need to, oh, go ahead. If you, quick comment, Tia, and then I think, unfortunately, it's 8:30. We need to wrap it up. I'm sorry. I would love to listen to this conversation for a lot longer.
Oh, not a problem. So one of the things I was just going to say is, what I look like is not always what I feel like. Mm-hmm. And when you talk about patients, chemo brain is a real thing. And it's not just when you're going through treatment, but it still lingers post-treatment. And then the flip side of your question is, as a patient, how do I be sensitive to my caregiver? Because, my mom still has a hard time talking about what I went through. And I'm a big advocate, but she has a hard time. And I didn't understand it when I was going through. But now that I support other people, I become closer to them. Now I see what she means, to go back and read stories and you see the transition and change in the stories. It is tough. So I think on the flip side, as survivors, being sensitive to our caregivers as well is important.
For sure.
Absolutely.
And appreciate them. So,
right.
I'm going to unfortunately need to wrap it up. Consuelo, Joy, Tia, Crystal, it's been an amazing conversation, and I mean that from the bottom of my heart. The chat has been so active. People have been commenting and cheering all four of you on through the evening, and I think you've seen some of that. What an impactful and powerful conversation tonight. And I hope that every healthcare provider listening and those that will listen to it in the future, hear it and put it into action tomorrow morning when we see our first patient. So thank you so much for sharing from the heart, for sure. Next slide. So the conversation will continue. This is our fourth and final forum. However, I did want to just mention there is a small group, a committee of 6 of us working very, very hard to put together the themes from the from these forums. We will be putting together the themes. We will be making a publication. We have some funding from Emory University, which we're thrilled about, in order to disseminate all of the incredible information that we've pulled together through these forums. We don't want the conversation to be stopped at this point. We want to continue it. And so we feel like getting the word out there is a very, very important next step. So you will hear from us. You will get emails about this when we're ready to share it. Next slide. We've had some champions for change. Thank you so much for your support. Some of you are Turning Point staff. Some of you are part of our international outreach group to increase access to rehabilitation and exercise for women throughout the United States and indeed around the world. Some of these are just people that are out there doing clinical work and research in the area of breast cancer rehab. Thank you so much for your support. And thank you to our sponsors. These sponsors have been with us, both spreading the word and getting the word out among healthcare providers and patients and advocacy groups. And next slide. as well as being financial supporters to support Turning Point's financial assistance program and other outreach that decreases barriers to care for women and men going through breast cancer. And there's my email address. There was a, feel free to email us. It's BC Survivorship or just J Binkley, either one at myturningpoint.org. There was a question that came up about wanting to know a little bit more about our panelists and our moderator. That is available on our website. All of the bios are there and any affiliations with some of your advocacy groups. I think there's people that want to follow you. So that's great. So can't thank you enough. Sorry we went a few minutes over, but it was well worth it. We could have talked for another hour, I'm sure. Thanks again, everybody. And thank you for joining us, everyone.
Thank you.
Thank
No.
you.
Thank you, everyone.
Take care.
Take care. Have a good evening.
Good evening.
Yep.